the Minister of Health and Wellness.
Thank you very much, Stephen. Good evening, ladies and gentlemen, and welcome again to another COVID Conversations. We look forward to an informative discussion, and hopefully at the end of it all, we will be more informed and more prepared to deal with the COVID pandemic that we are currently facing. We will also be joined, Stephen did not mention, apart from the regular team that's here, by Mrs. Diana Blake Bennett, General Manager of Salada Foods. We want to hear from her because in the case of the workplace protocols, which we have been pushing over the past few weeks, the revised workplace protocol, Salada Foods has had an experience of having a positive, I believe, 2 positive cases within their entity. They did not shut down. They did what was necessary, but business continued. And we thought it would be a good experience to share in keeping with the provisions of the revised workplace protocol. In the meantime, however, there are a number of other things that we would like to address this afternoon, given what we have been picking up from the field and framed against the background of our COVID-19 numbers. We sense in the population that there is an increasing level of dissatisfaction, disaffection, concern, all my words, of the response to COVID and the work that the government is doing and the Ministry of Health is doing, certainly over the past few weeks, and in particular during this phase of community transmission, which was announced, I think, on the 4th, officially on the 4th, but was suggested a few days or so prior to that. We sense a number of Jamaicans are feeling as if more needs to be done. And frankly speaking, we appreciate the genuine concerns that are being expressed, that have been expressed. And we see as our duty a responsibility to provide clarity where that clarity is required, to promote understanding where that understanding may be uncertain, and to give a sense of comfort and confidence to the population that the government, the ministry, are doing all that it can to ensure that the response to the COVID pandemic, the COVID threat, is adequate, is thoughtful, is deliberate, and is acting in the best interests of the population. I want to take the opportunity to say that we are, as a government, as a people, and certainly as a Ministry of Health, continuing to take COVID-19 and the response to COVID-19 as a very important and an absolute priority for the health and wellness of the population. The numbers are concerning, and every positive case is a concern. Every death is a tragedy. And so we each day deliberate over how to improve the process and the response. The truth is that we are in community transmission phase, and the CMO will reiterate and explain what that means later on in our clinical terminology. However, community transmission is where, I remind the country, there exists the inability to relate a growing number of confirmed cases to the source of infection, and or otherwise where we see increasing positive tests through routine systematic testing of respiratory samples from established labs, whether in the private, from the established labs. Both of these scenarios exist. So we are picking up cases that we can't track or trace to an index case, and also cases that are in a sense, unannounced until the evidence supports the confirmation in a lab. The truth is that none of this is unusual for a pandemic of this scale. It is expected that we would have gotten to this stage, and we did say we would have gotten to this stage. It is therefore for us, in a clinical sense and in a strategic sense, part of a process that we have to deliberate over and respond to. It is not a time to panic. It's not a time to give up. And it's not a time to engage in despair or even negative thought. It is a time to be resolute and to work together, each of us, to overcome the process. The ministry and the government, in anticipation of this phase, has triggered the response that is necessary, that we have been planning for some time, to address the phase that we're in, to mitigate against the risks, and to give the added protection that is requiring of all Jamaicans. Contrary to reports in the news media up to earlier today, that contact tracing has been ceased. We no longer do contact tracing. We are still engaged in contact tracing, and that therefore is a wrong impression to give. That is why we had announced long ago the engagement of additional staff in the field in the form of community health aides. And we have gotten permission and have budgeted for up to 1,200 such personnel. And as said last week, we have between 700 and 800 already deployed. So contact tracing is a critical part of the response, and more so during this phase as we seek to cauterize as best as possible any further transmission once we determine where the positive cases are. It is in anticipation of this phase that we sought and got permission from the Ministry of Finance to add an additional 121 medical officers to our clinical team. These were posts that never existed before. We have created these posts. We have assessed the places for deployment, and these individuals are on board since September 1 and have been deployed. The equipping of our health facilities to enhance their capacity to deliver specialist care. It is in anticipation of this phase that those efforts were made, that those resources were spent, that the training and all the accompanying measures were advanced to deal with the time when we would need it most, which is now. The further enhancing of our testing capacity with the introduction of the antigen testing, which we have announced. It is in anticipation of this phase that this measure or this decision was taken. And finally, but by no means least of all, just to give you some of the measures, it is in anticipation of the possibility of a greater demand on the public health infrastructure as we seek to provide medical care to those who need it most, that the plans were always in place to expand our bed count through the deployment or the build-out of field hospitals, the first of which was officially opened today at the National Chest Hospital, where I attended, the team here attended, and of course the Ministry of Foreign Affairs, Foreign Trade, and the U.S. government delegation led by the U.S. ambassador. That facility is now up, available. We have staff to man the facility should we need it. We do not need it at this point, but it is because of the forethought or forecasting of the possibility that we will need it one day why it has been put in place. We're now using a third or so of our 350 plus COVID ward beds, and so we do have excess capacity. But we're thinking ahead, and we did anticipate that that may be the case. 3 other such facilities are going to be put in place. We'll speak to that later on. Tomorrow I will be at Falmouth Hospital at 10 a.m. in Trelawney, where we will assign to develop 2 additional facilities, one in Trelawney at Falmouth, another at St. Joseph's, and we're finalizing plans for the importation of another mobile field unit out of Canada, and we should be completed with that very soon. I say all of this to say that the government has always taken very seriously the response to COVID-19. We have been in constant planning mode, execution mode, operationalizing the plans since January of this year. And it is a tribute to the hard work of the team why we are where we are today and why we have been able to respond. We are available at all times to clarify concerns. What we certainly would discourage is the attempt, inadvertently or otherwise, of spreading a sense of despair where, frankly speaking, none should exist, because there is a plan, there is a program. Now, we understand that when one is affected, when a relative has COVID, when a relative or friend dies from COVID, it creates the levels of sorrow and grief that one could only imagine unless one is in that particular case. And I want to just say to the public, to the country, that we regret all deaths. It's not a good thing. We have all identified or can identify with the death of a loved one, a relative, a family member. But that is not to say that we're not doing all we can in order to address the issue. We did project that based on the epidemiology modeling of COVID in the early stages, all the way back in January, I think it was, or February, that all other things being equal, meaning given no intervention, given persons just living as normal prior to COVID, we could see up to 1.5 million persons being affected or infected, and some 889,000 of those seeking medical care. That was a projection based on a modeling. The reality is that based on that modeling, we put in place a plan to mitigate against that level of impact. And to date, if you look at the numbers of positives, hospitalization, and the unfortunate cases of death, the truth is we're doing much better than the modeling suggested. And that is because of the work that we have put in. And I say work that we have put in, and I say we in a very collaborative way. It's not just about public health, it's about not just about the government, it's about the private sector, it's about you, the people on the ground, who have played your part by wearing your mask, sanitizing, social distancing, staying home after curfew hours, working from home. It is a collaborative effort. And I want to make it very clear, the country is doing better than had anticipated or forecasted based on the interventions that we have made as a government, as a people, as a country. And so we should take hope, not despair, in the fact that despite the community transmission that we are now experiencing, we are doing better than had been the case or would have been the case if these interventions did not take place. But, at the same time, I want to say that how we're doing has to be put in proper context, because a lot of the scenarios that have presented themselves to us as a people in terms of positive cases could be further be enhanced, meaning less cases, if as a people we all observe the protocols that were put out. And let's be very frank. We saw a very, very graphic, straightforward example of non-compliance last evening with a party that was being held in one community, where the police went and warned the party organizers, went back, warned them again, and it ended up in a confrontation where the lawmen were stoned because persons felt that they should not be bothered in the context of the law, saying that you should restrict yourselves from this type of activity at that particular hour of night. Now, that led to some arrests, I think 12 or 13 arrests. But that is one good example of why things could be better, but are not, because not everyone is complying with the rules of engagement under the circumstances. I say that to say that we have to recognize that all of us have a role to play. And to the extent that we play our role is the extent to which we will defy the modeling that was done. To the extent that we don't is the extent that we could go to that level of impact, which we don't want. We are researching in conjunction with the Statistical Institute of Jamaica. We're doing a knowledge, attitude, practice, and behavior study, KAPB study, which I understand a draft is now available, looking at how Jamaicans approach the response to COVID, and that is a further attempt of scientifically assessing what is happening on the ground. We've seen manifestations of it anecdotally, but we want to know in a more scientific way and how we can intervene further in refining the plans to deal with this pandemic that we are confronting. So we are continuing the efforts of assessment as we refine the strategy. It is a daily and weekly occurrence, which is why we have these conversations to say to Jamaicans, this is what is the case, this is what we need to do in order to manage the process as we go forward. I want to close my fairly long intervention this evening, and I think it's necessary because I am concerned as Minister of Health about the mood of an emerging mood, let me put it that way, in elements of our society, which seemingly is suggesting that somehow we're losing control in terms of our response to this pandemic. And I want to reassure the public that to the extent that we need to provide leadership based on the information that we have, we are committed to providing that leadership and coordination. I'm speaking broadly as a government, but certainly as a Ministry of Health and Wellness. The 17,000 or so healthcare professionals are committed and remain committed. To the extent that we overcome the challenges of COVID is the extent that all of us observe the protocols and play the role that we must. The announced measures around community transmission are not measures that we take lightly or measures that are based on our own advice alone. These are measures that are influenced by broader study, broader policy and assessment, collaboration with our multilateral and bilateral partners. And so these protocols are important for this phase, and we certainly invite and encourage all Jamaicans to participate and be a part of the process. In the week to come, I will certainly and the team make ourselves available to media houses. I've been traveling through the country in the last few days, speaking to critical stakeholders to ensure that the message is consistent and the response is collaborative. And that will continue. What we cannot afford to do is to lose hope in a time when it is the hope and aspirations of the will to overcome that will take us through this challenge. I have no doubt that we have it in us to do so. We are a focused people, we will work hard, and we are ready to do what is necessary. All we ask is the combined effort of all of society. All right, so at this time I will break and ask for further insights from Dr. Karen Webster-Carr, our national epidemiologist, and Dr. Nadine Williams, Director of Health Services Planning and Integration, who will put some slides up and give a little more detailed analysis as to where we are. And from there, we can further assess where we need to go. Dr. Webster.
Thank you, Minister. So this evening, I'll go through some of the numbers and show you how we are progressing throughout this COVID-19 outbreak. So the slide shows what is called our epidemiological curve, and it looks at when persons started to have symptoms. There, if we look at the next slide, it shows the progression from each 1,000 COVID-19 case. But there is some hope. It might look dramatic that, oh my goodness, there are a lot of, the numbers of days is decreasing. But when we look at it, there is some stabilization or slowing of the increase. So there is hope that we are, while still increasing, the slope is decreasing. So it took us 151 days to reach the first 1,000 case, then 20, then 8, then 9, then 6. But there is some stabilization, and hopefully it means that if we continue or we improve our actions as a society, then we could see the flattening of the curve, and hopefully we would have peaked and start going down from that peak. This just shows you what I mentioned before, and we looked at the estimated reproductive rates, and while it has increased again as of late August, it's not as much as it increased around the 7th and 8th of August. So what are the symptoms that persons are displaying? For persons who have symptoms, the most common symptoms are cough, fever, headache, shortness of breath, sore throat, and loss of taste and loss of smell. About 10% of persons have these symptoms. Just to say, all parishes are involved, and everybody needs to make the necessary actions to prevent continued spread. This is at a community level so what it's really saying, everybody should take heed, because the person next to you may have COVID, or you may have COVID and you would not like to spread it. We just wanted to update about the cases. This is looking on by week, and we've had about, most persons survive, but about 1.4% of persons with COVID has died. Men are more likely to die than women, and as you get older, the next slide, you are more likely to die. So it's telling us that we need to protect the older persons in our society. Almost all persons who have died had at least one risk factor or comorbidity, and many had numerous. So when we look at persons, their stay in hospital, we note that some persons didn't even make it to the hospital alive, but it also speaks to, we need to ensure that we seek health care early. Persons died on average 9 days, with a range of same-day death, and that happened in 3 instances, and up to 46 days in hospital. So this is the distribution across the country by parish, and when we look at the per capita, Manchester, Clarendon, KSA and St. James were the parishes of greatest concern. And that's what we'd like to present on this aspect of the COVID cases.
Thank you, Dr. Webster-Carr, and the Chief Medical Officer would like to add her voice to an element of the assessment. Dr. McKenzie.
Right. Thank you, Minister. Good afternoon, everyone. So we have been having some questions in terms of our recoveries. How many persons are recovering from COVID? And so just to have a brief note on that, we've had 5,558 confirmed cases. And I just want to point out that 96.6% of these cases have been cases with no or mild symptoms. So only 3.3% of cases have actually been moderate to severe illness and would have been monitored in hospital. Of the cases that we would have monitored in hospital, this 3.3% of all cases, we would have found out that only a very small percentage of those, overall 0.35% of the number of confirmed cases would have required ventilatory support. Now, in terms of the recoveries, what we would have seen of the persons that we would have monitored in hospital, so far 23% would have recovered, and we still have in hospital 36% of persons, or 67 persons that we are monitoring that are moderately to critically ill. So as we had pointed out in our earlier predictions, the majority of cases are going to be either no symptoms or mild symptoms, and many of these can be managed at home. For the moderately to critically ill persons, those are the persons that we need to monitor in hospital. A very small percentage of the overall number, but very, very important that you take all the precautions to prevent the persons who are more at risk for these illnesses, for this severe illness, to become ill, and therefore all the necessary precautions to protect the elderly. As our epidemiologists had shown, the elderly persons are more likely to have a severe illness and have a poor outcome. But still, they still do remain a small amount of the persons that overall end up in hospital. So, Minister, that is what the numbers are looking like. And just to ensure again that persons take all the necessary precautions to protect those persons that are at risk, the persons with comorbid illnesses, and the elderly persons. Thank you.
Thank you very much, CMO. I'm sure the media will probably have some questions on that later on, but it does paint a picture in terms of the extent of impact of COVID on the population, and the extent of serious medical impact. We are committed to protecting all, but there are vulnerable communities which require particular attention, and the evidence supports the fact that it is those who are vulnerable, primarily by age, but very importantly by comorbidities, by underlying conditions, that are going to be impacted most. Part of the challenge or responsibility of the community health aides, having deployed them throughout the country, is to go into their communities, or those communities, and to work with the health centers that they are assigned to identify those very vulnerable groups or individuals. So they would visit with these communities. They would determine who are the ones that have underlying conditions, and those records are available within their health centers. They would ensure that these persons take their medication. The National Health Fund now offers a delivery service, so for persons who can't go out, they can get that support. They would give advice on the mask wearing, not congregating, and the sanitization methods, to ensure that these persons who are vulnerable are given adequate information to understand that how they operate within their surroundings will have an impact. Oftentimes we don't talk about the healthy and the strong and the young in these communities. And the truth is, while they are not vulnerable, as the evidence suggests, or as vulnerable, the truth is they can in fact transmit the virus to their grandmothers and their mothers and the older, more vulnerable population. And so the messaging is very important that we speak with those persons. And that's part of the sort of community outreach which we have embarked on during this phase to help all of us to understand that we have a role to play in either preventing getting the virus, but also from spreading it should we have it, because it will have an impact not just on us but on others around us. Now the question is asked about budget and how we spend the resources around COVID. A general comment is that the government has been committed to ensuring that what the system needs, whether it's the frontline workers, the hospitals, or otherwise, then the necessary arrangements are made to facilitate the COVID response. And, I can say with confidence that the government has never really restricted the approach based on the demands or the needs of the system. And the system has not been placed at a disadvantage because of resource constraints. We have been responsible in the approach in terms of the spend, I think. And as a consequence, I think we have seen value in terms of the strategies that we have pursued. But I think in the interest of transparency, the permanent secretary, who is the chief accounting officer, periodically feels it is his obligation, and I support that, to give an account or at least a general report on how we are spending the resources of the taxpayers towards the COVID effort. So I'm going to hand to PS now so that he can just quickly run through some details, some general details.
Thank you very much, Minister. As you have pointed out, Minister, it's very important that we provide information to the public around the resources. Now, the resources are so critical to the operation of our COVID response that it is important that we give an understanding of what the resources look like, what are the availabilities that we have, and how we have been supported by the Ministry of Finance in actualizing the efforts that we have outlined week in, week out. So since the beginning of this experience, in last financial year, we received $2 billion, but because we are reporting on within financial years, we're going to report today starting from April at the beginning of the financial year. And what we can see from this slide is that we have received approximately to date $5.5 billion of, or approximately $5.6 billion of income from the Ministry of Finance and the Public Service. The largest portion of resources coming in June, 34% of the income coming in June. And when we look at the expenditure, we recognize that we have had a peak in expenditure in June and July, and that's primarily, Minister, because of the commitments that we made in March and April. And so our commitments to equipment, our commitment to PPEs, our commitment to drugs, our commitment to the build out of infrastructure. And those commitments came in June and July, and we were able to pay those bills to the tune of $4 billion. When we look at income and expenditure over the period April to September, we recognize that we have a cash balance currently of about $1.5 billion. Now, of that $1.5 billion, approximately $370 million are commitments that are to come in for payment. The balance, Minister, though, is based on other expenditure that we will have. So tomorrow you will sign contracts that will be committed against these balances that we have in our accounts. And finally, Minister, let's look at the expenditure. Where are our cost centers? And basically, you can see the major cost center for us is on drugs and PPEs. That should be drugs and PPEs, where approximately $1 billion have been expended in terms of equipping our staff with personal protective equipment and procuring the necessary drugs and sundries necessary for the COVID fight. The next high expenditure item is the amounts that we spent on accommodation, and that is primarily based on the return, the the controlled re-entry program that we undertook in April, May, June. Then we have the support to our regional health authorities. Approximately $728 million have been sent to the regional health authorities to provide support to the activities on the ground, the work of the contact tracing, the work of the health centers, the work of the hospitals, and of course the salaries that we have to pay for the additional staff, the 121 doctors, in addition to the community health aides that we have assigned. And you can see, sir, the total expenditure there, which shows that overall the plan that was designed for the purposes of mitigating and managing the epidemic is being executed and is being fully funded to a large extent by the resources from the consolidated fund. So we are executing in accordance with our objectives of managing the pandemic. Thank you, Minister.
Thank you very much, PS. I'm sure you may get some questions from the media on the expenditure, but again, we have given the general expenditure figures, and I want to just reiterate that the government is committed to doing what is necessary to ensure that the COVID response is maintained in the interests of the population, and the clearest signal there is reflected in the allocation as needed for the COVID response. All right, so if Stephen, do we have we have the CEO of Ms. Diana Blake Bennett of Salada Foods online, and Salada Foods, I guess she'll say more about who she is in terms of and who the company, but they've had an interesting experience, as I believe other companies will have, which is a positive case in the company, and they've had to deal with it. And we thought it was necessary to have a conversation around the workplace, given the workplace protocols that have been revised under community transmission, which essentially does a number of things, generally speaking. It speaks about ensuring workers understand in their workplace environment what COVID-19 is, and what they need to do to protect themselves. It speaks to the fact that they must work and operate to support each other, because the weakest link could compromise the entire production process. It speaks to elements of screening, 6 feet distancing, the wearing of masks on a consistent basis, an isolation area, a quarantine area, and all of this is geared towards, and more consistent cleaning, all of this is geared towards minimal disruption if there's a positive case. And we certainly admire the efforts of Salada and Ms. Diana Blake Bennett, because they have had some experiences and they have lived through those experiences without shutting down their entity, much I'm sure to the delight of those consumers who support the Salada brand, right, Miss Blake Bennett? Welcome
Certainly,
to
Minister.
COVID Conversations. Can you tell us a little about Salada? I mean, what do you do?
We are the premier instant coffee manufacturing company in Jamaica, the only one of its kind, I would like to add. We make instant coffee and instant teas. Our brand is the Jamaica Mountain Peak Coffee, which most of us have consumed for the last 50 years. We are also a listed company on the stock exchange, and we have been on the stock exchange since the stock exchange's inception in 1969. So we've been around a little for a while, Minister.
So tell me, how many your manufacturing facility then? As manufacturing and
Yes, we are
distribution?
a manufacturing company.
Okay,
Yes,
so you have a
yes.
production line. What's your staff complement like?
We have 120 workers that work in our facility.
Okay, great. So tell me now, you've been around for a while, so you've seen many challenges in business.
Yes.
This one being the
Certainly.
latest and perhaps one of your main
Most challenging.
most challenging. I think the country wants to know, and others looking on other entities, and certainly from our standpoint in public health, how have you approached the COVID public health threat while still balancing the need to manufacture and to supply on a regular basis your products to your customers? What are the processes which would be captured, obviously, in the protocols that we have put out?
Certainly, we took certainly from the inception of the first case, we met as a team and we came up with some internal protocols. And I think one of the advantages is the fact that we were already working at a high level of safe quality foods, because we are a food manufacturing entity. But from as early as maybe about mid-March, we mandated across the plant that everybody should wear masks. And we installed all of the additional sanitation stations around the plant. And I think important, Minister, was our communication strategy. We met with our team. We consistently engaged them, advising them, in tandem with what the ministry was saying at the time, to keep distance. We even looked at our packaging rooms to ensure that the staff working in each room were at minimum 3 feet apart, to ensure that there was enough room. We pulled down things like our lunchroom, removed chairs to ensure that there was no consistent gathering of persons. So those were some preliminary things we did. But even with that and enforcing it, I think one of our biggest pieces of communication to our team was when we made the decision that we weren't going to have people, we were going to continue to pay persons if they were reporting ill. And I think that was very important, as we communicated to them that, we were constantly engaged with them, speaking about the fact that if you were ill, don't report to work, just let us know. We consistently asked members of our team if there was anybody in their community that was ill. Those were conversations we had consistently on the ground with our team. Mm-hmm. And so we had our first brush with COVID in August 18. We had somebody who reported ill. And based on symptoms, the person had reported to their health center. And that was also very important for us to remind our team members that the health centers in their community was where we wanted them to be tested, because I think that would give the ministry some idea of what was going on, which they did. They consistently did that. And so our first case on the 18th, we recognized that he was sent to be tested. And while we awaited the results, we did our own internal contact tracing. We pretty much pulled all the persons that would have come in contact with that individual. We sent them to be tested at their respective health centers, and we cleaned. And we didn't just clean the area that they were operating in. We cleaned all the areas for which there could have been high contact. So we cleaned the lunchroom, we cleaned the changing rooms, and we just consistently, we cleaned down on the first day, and then we had before actually improved our whole sanitation process. So with that, we even engaged a company to just test our doorknobs and or high touch areas, whether or not they could identify any COVID strains and with that we were comfortable that we could continue operating because it didn't come back with any kind of positive COVID strains within the plant facility. Within another 3 weeks, we had some suspected cases, and the same procedure we employed. At no point did we close our production operations. We continued to manufacture, and we continued to sell to our consumers. And that's pretty much what we have been doing. And we have been consistent in every time that there is a suspicion of cases until we have that confirmation. We engage in cleaning and we clean all of the areas. We have pretty much 100% compliance on the plant now of mask wearing, and I do think that that has helped significantly.
Well, first of all, I want to commend you. Do you have a unit in the company that is sort of a COVID coordination unit, or do you have someone responsible to sort of enforce these protocols, these measures?
Well, we do have a quality and sanitation unit which handles all of that planning and preparation. But Minister, we took it a little further, I would like to say, it became a management enforcement. So it wasn't just the unit, it was me walking the plant and enforcing what's being said by the unit. The operations manager engaging with the team daily on the floor, the supervisory staff doing the same thing, because it is something that you have to consistently remind people to do. In the initial phases, people were wearing their masks underneath their chin. We would walk and see people not adhering to what was mandated. And as we continued to enforce and to communicate, we saw changes in behavior. And now I can happily say we have 100% compliance.
Well, I want to thank you very much, Ms. Diana Blake Bennett. Really proud of what Salada is doing in regards to the COVID response. What you're actually saying in your testimony, if you will, is that it is possible to live and to mitigate within your work environments against the COVID risks, even when you have periodic positive cases. And that is the essence of the message that we need to get across to all of Jamaica, and in this case, to all workplaces. I wanted to ask you, how expensive was it in terms of additional cost to do what you have said that you're doing? Was it more will or more money? Which one?
I think it's both. Money, certainly, because when we do our quarantining and send home team members, it increases our overtime because we're not shutting down. We have to bring in people to clean. So it does increase the cost. And will, certainly, because the reality is that COVID is something to be feared, and there is a lot of fear within the organization. And so it is really the will of all of us collectively that has pushed us past this point.
Thank you very much, and continue to do what you are doing. And please call up some of your colleagues and just encourage them to do the same, because it's really because all of us are committed to this process that we'll get over this as quickly as possible. Best wishes to you and your company.
Yes, I will do so.
Thank you. I must say to the listening audience that I had the opportunity to visit the Surge manufacturing facility in Bogwalk. That's a Surge dairy line of products. I think it's part of the Mussels Group. And myself visited with Richard Pandui, who is not just the managing director of the group, but he is also president of the Jamaica Manufacturers Association. And I was very impressed with what I saw there. In fact, the protocols were very much in place, from boarding the bus that they provided to take workers to the plant, temperature checks, consistent sanitizing of the vehicle, to the screening process when you arrive, to the sanitizing stations, the wearing of masks continuously, the consistent cleaning, the quarantine area, the sick bay. Really a plan that was deliberate and in place, and as a consequence, they have been able to function quite well in an environment where there is fear, but they have provided the leadership to overcome that fear. So it's possible. It's possible. And we have to come to terms with the possibilities and be motivated to do what is necessary in this environment. We can live as we work to overcome the threat in a manner that allows us to produce. And I'm focused here now on workplace protocol. That's my area of focus, because that's what we need to push right now to overcome the challenges of COVID in a community transmission phase. I went to St. Anne yesterday, where I met with the chamber there, and then we went and toured a supermarket, not manufacturing now, this is retail/distribution. And we visited with the Champion supermarket in Ocho Rios. And I was impressed again. I'm not easily impressed, PS, you know that, right? I was impressed again with what I saw at Champion supermarket in Ocho Rios. This is a supermarket that attracts hundreds, if not thousands of people within a relatively short space of time. You entered the facility, there was a digital temperature check machine. They put their hand on it, the person, and it would automatically scan their body temperature, and it would tell you whether you have an elevated temperature or not. There was someone standing there monitoring that. He was at the same time spraying the hands with the sanitizer. There was a wash station at the door where persons could either get sanitized from the spray bottle or wash your hands at the door, soap and water. Then you went in. I saw a youngster charged with cleaning the trolleys. So all the trolleys that were used, he was there spraying and cleaning off the trolleys. Ongoing effort, because that's one of the areas that many different persons touch. There was another set of cleaners who were constantly monitoring the floor. The employees all had around their necks in a sort of necklace type setup sanitizers provided by management. The cashiers, that area where many people pass and touch, is consistently sanitized. And what it demonstrated again to me is that in all settings, we can implement and practice the protocol to minimize the risks. I felt safe in the Champion supermarket, in a retail establishment with many people around, because no one was allowed inside unless they had on the masks. No one. And unless they temperature checked, unless they sanitized their hands. And that told me that the persons coming in were sufficiently protected, or I was sufficiently protected if any of them were even asymptomatic with the virus. And all of this I say to say that we have to come to terms with the reality that all of us have to play our part. And in the case of these three entities, it is an example that it is possible, and possible everywhere. We will continue to highlight the recovery stories, because we need to not just create hope, we need to show what is possible. And in this instance, we can live and we can overcome COVID. And I'd certainly encourage others who are influencers in our society to help us to do the same, because the society needs it so that we can have the drive and the will to continue until we overcome. All right, before I ask for the questions to be asked by the journalists who are on, we did not mention that last 24 hours we saw 193 cases of COVID, positive cases, and one death in the last 24 hours. which brings the number of deaths to 77, I am told, and recoveries over the last 24 hours to 1,490. So we've had quite a number of recoveries, which again is good, in keeping with what the CMO said, that most persons recover. One death and 193 positive cases. We will continue, of course, to update the data around the statistics on a daily basis. At 10 a.m., visit the Ministry of Health website, and that information will be provided. The next new update will be at 10 a.m. tomorrow on the website. Thank you very much, and Stephen, over to you for questions.
Thank you very much, Minister. So inviting the members of the media on Zoom to use the raise hand feature to ask your questions to the panel. And I ask that you introduce yourselves, your name, and the entity that you're representing before you ask your questions. We're going to begin with Janet Silvera.
Thank you. Good evening. I am from the Gleaner. My first question is to the CMO, who had promised to give details on hospitalization and recovery rates for the elderly. For the elderly. And the recovery rates as well. So what I want you to do is to provide us with the stats on those who are 60 to 69, 70 to 79, 80 to 89, 70 to 99. It was a promise you had made to us, so I'm just asking you to give us an update on that today. Also, I would like to find out if tourists are now being allowed to visit attractions throughout the country. Why are we still not allowing tourists who are staying in one hotel but wants to split their vacation by staying in another hotel, possibly in the same resort area? For instance, the small EP hotels are concerned about the fact that they still can't get business from persons who come into the country who want to have a double stay. In other words, stay in a large property for 4 days and then stay in a small property for another 3 days. Also, can you tell me what the status is as it relates to PCR tests and rapid tests? Have we started implementing that for visitors coming into the island, or are we going to not bother to do any tests whatsoever and just allow persons to come in? Thank you.
Simo, I'm not sure if you have that kind of detail on the age groups and the hospitalization. All right, so the CMO is checking on that. Let me try and answer the policy question on the whether or not why a tourist is allowed to move from one large hotel to a smaller hotel. Again, the concept and the principle of movement is what determines the approach to, is influenced, I should say, by the risks assessment done around moving people and potentially moving the virus from one environment to the next, one person to the next. The idea of introducing restrictions, whether it's curfew hours or restrictions on the elderly, or in this instance, restrictions on the tourists to stay within a particular corridor, is because the virus is highly contagious and it spreads easily once persons move. And the more they move, the more it spreads. So any decision that's taken around that level of confinement is based on that risk assessment. Clearly, the risk changes and decisions are adjusted based on that risk profile. There was a time when tourists were, restricted more severely. That has eased over time. And I'm sure that easing will continue as we manage the risks and mitigate against the risks. It is a review that takes place weekly. And the next review, again, Cabinet will meet on Monday. I know the Minister of Tourism, Minister Bartlett, is always very proactive and representing the interests of the tourism trade. So I could only answer you in a generalized sense to say it really is a function of the risk assessment and what that movement may represent from one hotel to the next. But that risk is subject to change and the decisions are subjected to change. So just keep listening, and you will hear the changes as those changes become possible and are approved by cabinet. CMO, you have the information, or you want me to speak on it? Well, you can speak on a PCR test versus rapid test. You want to give a general, or are you still looking at that? You want me to?
Yeah, go ahead.
Okay, so on the issue of the PCR versus rapid test, again, let's make the distinction now in terms of what these tests are. The PCR, of course, is the gold standard test. That's the one we do now, which collects the sample using the swab and then submitting that or sending that to the lab, 2 labs, in this instance, UWI, the National Influenza Center, or the National Public Health Lab. And that's the one that has been the source of great data, but also the source of great controversy, to be totally frank, because when persons have to wait, then it becomes a challenge. And in some instances, and I will accept, the wait has been long. But for a number of reasons, we have had that experience. At the same time, it is the most accurate test because of the processes that it goes through. And it is the test that is unlikely to be discontinued in the context of COVID because of its accuracy, but it comes with the time that you have to wait. The next one would be the antigen test, which was recently approved by the ministry based on recommendations from the World Health Organization and PAHO. So what is happening now is that there's a lot of research going on throughout the world. Many labs, many countries collaborating with each other, Jamaica included, in trying to find a solution to this global pandemic. It is natural that we come together to find a solution that benefits the world. And many of these research experiences are continuing. The ones that have been validated, and in this instance, the antigen tests, the 2 that have been validated by the WHO are the 2 that we are embracing and introducing to Jamaica. So what we have announced are 80,000 initial order that will then be available in our health centers or hospitals, and later on in the private space based on training that will be done. Now that test, which we hope the first batch will arrive in next month, will allow us to test within a half an hour period. But the test is best suited for symptomatic persons who have symptoms. The good thing about it is that the persons who are most concerned about long wait would be persons who have symptoms and would like to know the status of their position to adjust or manage treatment. The antigen test would be suitable for that person, and the turnaround time would be very quick. So it is going to mean taking a lot of the pressure off the system, certainly for PCR testing. And I can envision the backlog that we have periodically with PCR being eliminated or certainly greatly reduced with the introduction of the antigen testing. But we had to wait until we had the validation because we do not want to take unnecessary risks, even though we know that some persons have other tests that are not validated and certainly not approved by the ministry doing in the society. So that's the second test, the antigen. The rapid test that, or the other test that many persons refer to as the rapid test, I think is the antibody test. And the antibody test, which has not yet been approved or sanctioned by the ministry, and there are different types, is that test for the antibodies, meaning having had the virus, recovered from the virus, your body develops antibodies. So there are traces of the virus in you, but not affecting you. And that test is the test that many people refer to as the rapid test. The challenge is most times people misinterpret the reason for the application of that test, thinking that the antibody test can be applied to determine if you have the virus, when it really is applied to determine if you had the virus. And I can envision a time when the antibody test will be sanctioned, and it may not be long from now, but I'm not going to second guess the clinical team. But I am happy that we now have antigen tests coming, because I think the two that, once they are here, the PCR and antigen, will mean a much more efficient testing protocol. And that would apply to the tourists as well as to the rest of the population. CMO, I've drawn out the response to give you a chance.
All right, yes, thank you, Minister. Okay, I'm not sure if I had promised to get so granular, but I don't have the recoveries separated by age. What I can say, as we had mentioned before, that we've had 187 persons that were moderate to severely ill, and of those persons, we would have had a 23% who have recovered, and we would have had 36% of those persons that would still be monitoring those persons. As you would have seen, that most of our admissions in terms of our moderate to severely ill would have been over the last couple of weeks, maybe 2 weeks or so, and so therefore many of them would still be monitored. In terms of the age groups, Dr. Webster-Carr had presented a chart that had shown the age distribution of the persons who have died, and we would have seen that the majority of these persons would be in the elderly age groups, where for the 60 and above, we would have recorded 717 confirmed cases. And in that is the age group in which we would have seen the majority of our deaths. We would have seen 54 persons of those 717 that would have passed, certainly showing that the over 60 age group is a group that is at risk. And so therefore it is clear that we must protect this age group. I can subdivide that even further to say that the older you get is the more risk you face, because of the 60 to 69 age group, where we had 393 persons confirmed as positive, we had 12 deaths in that group, which represents 3% of that age group that would have had a bad outcome. While in the over 80 age group, we would have had 22 deaths in 115 persons, which represent 19%. So clearly, the numbers are really showing that the older age groups are the groups that are at risk. And so it is very, very important that we protect these persons. We would have seen that in the younger age groups, we would have had a very small numbers of deaths, certainly below the 39. From 0 to 39, we would only have seen 7 deaths. Of course, every death is greeted with a lot of sympathy, and we would certainly regret that any of these persons should have died. But certainly it is showing that for the younger age groups, the risk is much less, and these persons that would have passed would have been also have comorbid illnesses. So certainly the older you get, we must protect those persons. Dr. Webster-Carr would have also have shown that in these age groups, and we know that generally speaking in our population, that the older age groups have a higher incidence of comorbid illnesses, including diabetes, cardiovascular disease. And so where it is that those persons over 60, we would have seen a high incidence of those disease. Almost every person would have had at least one of those illnesses, and many would have had 2, 3 of those illnesses. So that's where the risk is, and that's where we need to protect our population.
Thank you very much, CMO. We're going to go to Brittany.
Okay. Hello, good evening, everyone. So I have two questions. The first one, in April, there was the announcement of a comprehensive review of all the relevant legislation, and there was a suggestion made to craft one to specifically address the COVID-19 pandemic. So I just wanted to find out if that has commenced, and if not, what is the ministry's plan to plug the loopholes in the legal framework governing COVID-19 protocol, just so that there can be more effective enforcement? And my second question is, what has been the COVID-19 positivity rate over the last 14 days, and how can or should we as citizens interpret that? Thank you.
Our epidemiologist, Dr. Webster Carr, to just address the second question.
Thanks. So the positivity rate for the last 2 weeks is 24.4 and 24.6. So we have seen some leveling of the positivity. And also, this is what I spoke to about the other numbers, that there seems to be a leveling off. There's still an increase in cases and still too high a positivity rate, but there seems to be a leveling of some of these features.
The legislations that we have to review. Yes, it is clear that there is significant work to be done in terms of reviewing of the legislation, and we know that we have the support from the Attorney General chambers in this regard. However, it will take some time to go through the review and to put forward new regulations. And so this is not something that we're going to get an immediate response on, but we are cognizant of this, and we are looking at the different legislations, including the Quarantine Act and the Public Health Act, to see how it is that we incorporate certainly the issues that we have faced. This now shows us the real challenges that we face, and is a stimulator for us to really have a quick review of this and to have the new legislations out.
And just to be specific, a special task force was set up, lodged in the Ministry of Justice, to deal with those that to lead the charge on the review. As the CMO said, the Public Health Act and the Quarantine Act are the key ones. So we'll update periodically as we move towards getting that adjustment, but it is in train.
Thank you very much, Minister. We're going to go to Ramanda Lyons from the Star.
Hello, good evening. I have two questions. So just to know, Dr. Tufton said that initially the estimated number of persons who would have been infected or affected by COVID-19 was 1.5 million, but that was reduced after certain strategies were put in place. So can you say, can you give like an estimate of where that number is now? And two, Dr. Alverston Bailey, public health expert, is projecting that as many as 17,000 Jamaicans could die from COVID-19. Is this in line with the government's projections?
I'm gonna say something, and then I'm gonna ask our epidemiologist to come in, since she's a scientist in this area. First of all, I just want to be clear that what I said was that the initial projections of 1.5 was based on the modeling early in the day, based on all other things remaining as is, and the extent to which we took action to mitigate against the virus spread and the virus affecting the most vulnerable, it would adjust the numbers. And to date, based on the numbers that we have seen, positive cases numbering over 5,000, about 5,000 plus, as well as deaths numbering 77, and hospitalization, I'm not sure what the hospitalization numbers, I don't have it here in front of me, over what, 8 months, 8 months. The truth is, Jamaica and Jamaicans are managing and confronting the COVID pandemic in a way that must be recognized, and they must be encouraged, because we have done fairly well. Now, we regret the negative impact of COVID, but we have done fairly well based on that modeling. I'm not going to extend it to giving you any projections, because the projections are based on how and what we do. And while government will prescribe policy and will enforce where we can, it is going to be up to all of us to take appropriate action in protection of ourselves individually and collectively as families, communities, and country. And to date, I think, for the most part, we have done well, but we still have some journey to cover. And the encouragement should remain as it relates to what needs to happen going forward. In terms of the issues around, what was the second part of the question? The 17,000 deaths. I really wanted to answer that one, because I don't want the impression to be given that we intend in any way, shape, or form to lose 17,000 Jamaicans to COVID, because I think... That wasn't our projection. And that was not our projection. Okay. Well, it's somebody else. It's someone else's projection. Yes, right. It was, you quoted a name. But I still don't want that impression to be given, because that would not be correct in terms of our own assessment, firstly. And secondly, it's not something one would want to encourage. I prefer to say, Jamaicans, do what you are required to do, given the guidance of the health ministry and the government, and you will minimize significantly the risks of deaths. And if we do that, I think we will not be anywhere close those numbers. But Dr. Webster-Carr, I'm going to ask you to comment on that.
Okay, thanks. So the numbers mentioned, I think what has happened, there are many apps, shiny apps, etc. online that persons can go on and do some modeling. We have reviewed many of them, and there was one that gave such a figure. But when we looked at how it modeled, how it performed in what has happened, it wasn't performing very well. So we have to, models are good, but they're just for planning, and all models are wrong. That's not my quote. So we have to be careful how we look at some of these apps and some of these models, because they may not be performing to what we have existing in Jamaica.
Thank you very much. We're going to go to Emma Lewis.
Hi, good evening, everyone. I'm Emma Lewis, and I'm a blogger. I'm still interested in the private care homes and wondering if they're doing okay and if you're able to monitor them for senior citizens. And my other question is about the prisons. I'm not getting a very clear picture of how many prisons do have positive cases and how many people have been tested. So, and whether any testing is going on, whether that's enough in the prisons as well as in the private care homes. I'm just thinking about these institutions that are, you know, kind of separate from the rest of the society and how you keep an eye on them. Thank you.
Right. So thank you very much, Emma. The government, through its respective agencies, in the case of the private care homes or standard agency in the Ministry of Health and Wellness, would monitor through inspections and approve or register, and even where they're not registered, and they would visit and inspect the operations of these homes, particularly the ones, of course, the elderly care homes. To date, thankfully, we have not seen any major outbreak. We did have one infirmary, one facility, I think in St. Anne, that had a case where we had to go in and test. It was an imported case. Someone brought it in. One of the mandates that have been given to the agency in the ministry is to provide the protocol around infection prevention and control to these facilities and to do periodic inspection to ensure that they're upheld. And thank God to date we have not seen any or heard of any outbreak. And we would know, because it would mean the public health system would have to respond if there was such a case. And we've seen cases in other countries that have been really bad. So we continue to monitor those, and that will be ongoing. The prisons, we work, of course, with the Ministry of National Security. We've had a case, at least one case of one facility having a few cases, and it triggered the protocol that has been in place where you would isolate those persons, you do testing, contact tracing, and so on. And that has been done, and as far as I am aware, that situation was dealt with and cleared up. I don't know that it has prolonged beyond now. It has been cleared up, the CMO confirms. So as of now, Emma, the institutional vulnerable are intact, as far as we know. And we continue to encourage and monitor to provide the critical support that is required.
Right. Emma, I just want to reassure you that the health department does have these homes and institutions on their radar, and they are doing the checks on not only the old people's home, but also the children's home and other institutions. So they routinely do that. They have increased their visits since COVID. So checking on the infection prevention control measures. So they are in contact. Every health department have these homes and institutions on their list. They are doing their reviews, and they are in contact with the persons that are in charge of these. Whenever there are problems that occur, we are informed, and we do go in and do the necessary to contain and to manage any problem that there is. Right now, we don't have any reports that have indicated that there is a problem in any of these homes.
I want to just quickly add to that on Saturday, I am going to be visiting one of the larger care homes in Western Jamaica as part of the outreach, if you will, just to see what is happening, to dialogue with the operators, to get a sense as to what is happening with persons who are in these institutions. Just as I have done with the workplace protocol in the supermarket and the manufacturing facility, I'll be visiting one such facility, in mask and all, by the way, so as not to represent any threat at all to those facilities. But it's important that we maintain the dialogue, and that dialogue must be two-way. So we want to see what is happening, but as the CMO says, we're confident that the public health team at the parish level are in touch, and they provide continuous support because we know that these institutions represent extremely vulnerable groups.
Thank you very much, Minister. We're going to go to Althea.
Good evening. Althea Saunders from the Jamaica Observer. Minister, last week you had mentioned that based on recommendations from the ministry, we could see pre-testing for tourists, and you mentioned... Are you hearing me?
Yes, go ahead, Althea.
All right. You had mentioned last week, Minister, that we could see pre-testing for tourists, and you mainly focused on the US being discontinued. Would that extend to other countries? And also the opposition spokesperson for health has said that they disagree with any plan to discontinue pre-testing. Could you respond to that? And second question is, you said that there's no discontinuation of contact tracing. So what I'd like to know is what about the highlighting and quarantining of communities where there might be significant outbreak? Is that still going to happen?
Okay, so let me respond to the pre-testing as a policy shift. Yes, I did indicate last time at our COVID conversations that the pre-testing requirement for certain parts of the U.S. Were under review, and decisions, of course, that are taken at the level of cabinet around the pre-testing would be made. I did express some optimism that some adjustment may have taken place, but concluded that it was a function of the risk assessment, which is an ongoing effort, and of course, a function of Cabinet's collective wisdom. When Cabinet met on Monday last, having had an extensive discussion, the decision was taken to not move on any adjustment for the time being. And that was echoed or voiced by the Honorable Prime Minister the Monday, was it Monday or Tuesday? Tuesday afternoon press brief at Jamaica House, and an explanation given. It was a function of many things. The numbers that we're experiencing, the surge level, the other concerns, even though there are indications of some progress as it relates to the extent of the virus and the spread of the virus in those countries, or that particular country from whence the tourists originate, and particular states better than others. The assessment, therefore, in response to your question, continues, and at an appropriate time, we will say if it will change, and that again is a cabinet decision. So right now it remains in effect until cabinet decides otherwise based on the risk assessment. The same would apply for all other jurisdictions, all other countries, because that assessment is wide scale. And so if there are changes, then we make those changes public. The issue of quarantining communities, I don't know if the CMO wants to comment on that. I mean, the assessment under the community spread designation does allow for any action to be taken, but maybe the CMO is best suited to speak to that.
Right. Yes. So there's no intervention that is ruled out at this stage, and as we continue to monitor the cases, as we discover that there are problems that are specific to areas, then we would still try to wall off those areas. What we are seeing now presently, for example, in Kingston and St. Andrew and St. Catherine, that we are seeing the majority of our cases is that there are several areas that are affected, but the cases are sporadic within the areas, meaning that we're not detecting huge clustering of cases. However, we do have quite a number of cases that are under investigation. And what we mean when we say that the cases are under investigation, it means that we have to track back to why this sample was taken. Is the person ill? Were they a contact? What was the reason why the test was done? So we still have a number of cases under investigation, and we're trying to expedite that process so that we can be able to make decisions like this to identify where there are clusters, because that really is what will trigger our response. When we see that there are particular problems, clustering that is occurring, that we believe that surveillance, enhanced community measures, enhanced public health measures will be able to wall them off, then we certainly are going to be expected to do that, and we will do that in response to this. So it is a process of really looking at the data and analyzing continuously what is happening.
Can I just add too quickly that we are now following some 3,690, I'm told, contacts throughout the country, which means that contact tracing is in fact taking place. taking place in a different way, perhaps not a quarantine community, but certainly contacts that are scattered across the country that requires some levels of tracing or investigating. And it's a lot of work, but it is happening, and we will continue and change as appropriate.
Thank you very much, Minister. We just have one more and a follow-up from Brittany. We're just going to go quickly to Jamaica Social.
Good night, folks. I'm Cassius Watson for Jamaica Social. Minister, you started out by saying that you've gotten a sense that people feel that the ministry has lost its gusto regarding fighting COVID-19. But I put it to you from what I've been hearing on the ground, and I've been consistently quizzing people about their thoughts. And I've spoken to, at last count, about 12 or 15 persons. And the consensus is that the Ministry of Health is now sitting in the stands and looking at the game. And I say, and that when I asked them further, they said they were recently expecting, when the Prime Minister spoke to the nation, some adjustments or some inkling of something being done. The fact that the last time he spoke with us, or the last time any real conversation about the virus, so many people had not died, and we never had so many thousands more of cases. So I noticed you also mentioned that you will be behavioral studies you'll be looking at behavioral studies regarding how people are responding to and see the virus. Do you think your message of living with COVID is one that somehow says to people, or is giving people the impression that everything is kind of fine and don't pay much attention to the virus, just you kind of have to just live with it? Because that's a response I'm getting from people. And I finally want to add to that in April, when you shut down an entire parish, we had 107 cases, I believe, at the time. And now we have 5,000 plus, and we've not really seen many interventions, outside of the last lockdown in St. Thomas. And they have mass numbers of people getting ill, hospitalizations, 77 dead. Is your message, is living with COVID the right message, is my question to you.
Right. So you've asked a very important question. You've made an important observation, and it supports the point I raised when I started, of the sense I'm picking up on the ground, not just remotely, but having gone out there and I'm relating to persons on the ground. And I think it's important to talk about it. So I'm happy you raised it. And I think it's a conversation that should continue and be frequent, because it's very important that we do not lose a sense of direction in terms of where we're going as a people, and we do not lose confidence in the process that is being pursued to overcome this phase of the virus. I will say that it is very understandable. I fully appreciate why some persons would get that particular impression. And I'm not being critical of those persons, except to say we need to talk more about it, to try to understand why we are where we are and what is being done and why it is important to be done in this phase of the spread or of the pandemic. You asked the question around shutting down a parish when you had only 100 cases as opposed to now having thousands, which would mean that we should shut down the entire country. That is a sort of understandably logical argument, given that it is based on a decision based on the numbers of positives. But if you look at the context and what the objectives were back then, as opposed to the objectives that are set now, you would appreciate, hopefully, a little better, and I hope Jamaicans will, if we talk more about it, the change in circumstances and the change in approaches that justifies the objectives that we set. So in the early stages, when we shut down and sort of swamped a particular area, whether a community or parish, the intention was to quickly cauterize what was considered to be a potentially sort of situation that saw the virus spreading, but in a way that could be stopped if we were to surround that facility, that community, or indeed that parish. And remember now, when we started out, it's about delaying the virus, cauterizing the spread as we prepared to deal with what we knew would have come, which is that the virus would, over time, become more prevalent in the society. So in those early stages, you took significant and drastic action in order to further delay and cauterize. Once you started to resume some normality, moving lifting restriction on borders, getting people back to work, getting persons who were stranded overseas because they went on a vacation and were stuck for 3 months and they needed to come back home and you couldn't keep them out forever, relatives, friends, that sort of thing. There was an assumption that in doing that, you would have more cases popping up. And once you got to the thousands of cases, the issue would have been now, how do you manage the multiple cases while at the same time preparing yourselves to deal with those who would need hospital care, and this is what we have been doing, protecting the vulnerable, which is what we have done by hiring the many community health aides, and providing an appropriate messaging for all the population to understand that they need to take precaution in order to mitigate against them getting the virus or them spreading the virus. Now, that's not a posture that should suggest in any way, shape, or form that we're sitting in the stands and watching. But it is a posture that says the virus is a lot more prevalent. It is not as easily detectable in terms of the index source. And so we all have to now be more vigilant and follow a particular procedure, as opposed to us saying, come, let us put you in an institution and keep you there. And I know it's a difficult sell because it seems counter to what was originally prescribed, but it is the approach that has to be adopted in order for us to pass through this phase. And it's not intended to make this phase less important than the phases before, or the role of the state, the ministry, the government less important. What it does, though, it realigns the strategy to fit the challenge of greater spread and the need for each of us to literally assume that we're all potential carriers, and so we must play a particular role. And what we would like is for an absorption of that responsibility that we all have. And we believe if we did that as a people, we would overcome the challenges as quicker than most. I don't know if the CMO wants to comment on it a little further, but that's my explanation of it as I see it.
Right. I think that the population of Jamaica really needs to ask themselves, what does living with COVID mean? Because living with COVID does not mean that it's life as usual or we go back to normal. That's not what it means. And so, therefore, if that's what people believe that it means, then certainly you're going to have rapid spread. And then you're also going to rapidly infect the vulnerable persons in the population, and we are going to get more deaths. That is not the way it is intended to be taken. Living with COVID means that everybody is vulnerable to catching COVID, and therefore you have to protect yourself at all times. It also means, we have spent the time here today showing how vulnerable the elderly persons are, how vulnerable the persons with chronic diseases are. So it also means that there must be a recognition in your families, in your communities. You have to take responsibility for your family members who have chronic illnesses, who are elderly. You also have to take responsibility for your communities, persons who are elderly and who have comorbid illnesses. These persons need to be protected. living with COVID means that you need to protect yourself at all times and you need to protect the vulnerable in the population. It does not mean life as usual.
Thank you very much. I'm going to go to the final question, which is a follow-up from Brittany Clark from Nationwide.
Okay, good evening again, everyone. So my follow-up is for Dr. Webster Carr. Earlier this year, it would have been said that, the positivity rate wouldn't, well, the projections at the time showed that it wouldn't necessarily surpass 5%, or it was just at about 5%. And we know that the projections change, but do the projections now reflect when we will ever see numbers close to 5% or even below 5%? And do we see that percentage decreasing anytime soon? And I just had two other quick questions as well, just for clarification. CMO, do you have any data to reflect how many of the recovered patients actually had comorbidities? And just seeking some clarification on the COVID-19 orders regarding churches, just the number of worshipers allowed, etc. Thank you very much.
Okay, thank you for that question. And so the 5% positivity is what is more indicative of control, and that we are, but remember, we're in community spread now, and so we have seen the increase happening. As I stated before, we have seen a leveling off of the positivity rate. So we went to like 0.7% in a week, and then we went to 3.9%, and then we went to 4.9, and then we went to 15.9, and then we are in the 20s now. So we have seen a leveling off, and hopefully this means something good, that we are slowing the curve, and that we will then start to go down in the positivity rate and hopefully reach less than 5%. It may take a few weeks, however, 4 weeks or more to see that happen.
Brittany, I don't have the data on the breakdown of the persons who, the persons who, other persons in terms of the comorbidities. So that is something that we would have to work on in terms of the analysis by our epi team to get that information, and also to get the information on, in terms of the recoveries, what are the levels of comorbidities in those persons as well. So I just want to say, though, in addition to what Dr. Webster Carr had commented on, was that despite the fact that we are in fact seeing that we are getting the numbers of positive each day now being probably more than 150, approaching 200, the dates of onset for many of these cases are still going back to the end of August, beginning of September. Now, we still have a lot of data to analyze, because we still have a lot of cases under investigation. So once we have gone through those cases under investigation, we would fully be able to comment on whether there is really a flattening or even an incline down. But what certainly would keep us up at the level would be that if we continue to have spread of disease rapidly, and if we continue to have exposure. So it really comes back down to the fact that persons, if we want to see that decline, which we could see after the investigation of these persons, then it must mean that we have to stop some of the activities that we are doing in country that will promote the spread, the exposure of persons.
Thank you very much, CMO, and thank you to our media colleagues for joining us. I'll turn over to Minister for his closing remarks.
Thank you very much, Stephen, and thanks to my colleagues for being here, and in particular to our special guest from Salada Foods for her timely intervention. I just want to say again to our listening audience, to Jamaica, that the COVID response continues and continues in earnest, that the team is fully motivated and working hard to provide the leadership, do the analysis, do the assessment, ensure that the critical players on the front line are given the support, that our hospital care and facilities are improved and expanded to accommodate those who need hospital care, and that the messaging around the sort of overcoming the COVID fight will continue in the context of all of us having an important responsibilities. All the measures that we have instituted at the level of the orders that have been put out have been considered for hours. And so when the government, the Prime Minister, myself, and others announce these measures are well thought through, and we are convinced that they will act in the best interest of the country. We have heard discussions around the curfew hours and why they should be lifted and whether or not they help. Well, they do, because the more you have movement is the more the virus can spread. And part of the slowing down and the management of the virus is to restrict, to some extent, movement. And that's what the curfew is about. That's why the 8 p.m. curfew is in place. People ask about their own role as opposed to the role of the government. And we say that we all have a critical role to play. Community leaders, influencers, managers at the workplace, we all have an important role to play. So we will continue to do what we must. We will continue to make ourselves available. Where there is doubt, we ask that clarity be sought, and the team here stands ready and willing to provide as much information to the public as possible, because we do not want uncertainty, because uncertainty drives fear, and we certainly don't want to encourage persons to speak about uncertainty. We want to clarify any concerns that they have. So thank you again. This has been another edition of COVID Conversations. We are considering increasing the frequency over the next few weeks of the COVID conversations, and the possibility of airing conversations from other parts of the country, focusing on specific parts of the country and specific activities. You'll hear a little bit more about that. But again, that is all in keeping with trying to keep the public informed and to address any concerns that persons have. But thank you, and let us continue to work together against COVID-19. Thanks.